Hi, everybody. I'm going to be talking about folic acid in pregnancy, and the specific nutrient I chose to explore is folic acid. So what is folic acid? It is a micronutrient. It is a man-made form of folate, which is naturally occurring through diet. It is also known as vitamin B9 or heteroglutamic acid, and it's a water-soluble vitamin. So what are the uses of folic acid? So folic acid is used by the body to perform de novo synthesis of thymine, adenine, and guanine, which are the nucleotides found in DNA cells. So folic acid helps to produce new cells for the formation of the fetus, and it maintains the DNA structure in creating the neural tube and the fetus. Folic acid also serves as a cofactor in many other bodily reactions. So this includes, as you can see in the picture on the right, things like digestion, brain and nerve function, liver, heart, and other organ health, blood cell function, healthy hair, skin, and nails. And an important thing to note is that folic acid helps to produce adequate amounts of red blood cells because there's an increased demand for red blood cells in pregnancy when developing the baby. So what is the importance of folic acid supplementation? So folic acid supplementation specifically is important for those who are pregnant or looking to become pregnant in the near future. So the supplementation of folic acid helps to reduce the likelihood of neural tube defects. And I found throughout my research that there was a reduced chance of neural tube defects from 5.9% to nearly 0.5% in the general population. That's a very great amount of people that can benefit from supplementing folic acid in their pregnancy. Another thing that is important is folic acid supplementation can alter the DNA methylation patterns of the offspring during the in utero period, which can influence development and later life health outcomes. So I'll talk about this a little bit later, but some of the later life health outcomes are heart disease, stroke, and things like an increased body mass index. Along with this, folic acid can also help with combating low birth weights, preterm labor, congenital heart disease, megaloblastic anemia, preeclampsia, placental abruption, and multiple pregnancy. And a lot of those are just complications that can occur during pregnancy. And when you take folic acid, it can help lower the chances of these complications occurring. So what are the recommendations for supplementation? So in 1992, after extensive research, the FDA recommended that folic acid supplementation was followed by all women who are planning to become pregnant or in the first 12 weeks of pregnancy. So it's important to note that it says the first 12 weeks of pregnancy. That's because in those first 12 weeks, especially in the first 3 to 4 weeks, that's when the neural tube is actually being formed. So that's why you need to take folate or folic acid while you're planning to become pregnant, because if you already have the stores of folic acid in your body, those can be used to obviously help the development of the neural tube and reduce the risk of those neural tube defects and other complications as well. So the recommended daily allowance would be 400 to 600 micrograms per day, and this can come from fortified foods or supplements. So folic acid specifically does not come in large amounts from regular foods we find in our diet, but it is added into breakfast cereals and other types of fortified grains and products. So it's good to have those, but also to use a supplement for at least 400 micrograms per day. Also, the amount that a woman should take may vary between a healthy woman and a woman who's obese, has diabetes, or epilepsy. Sometimes if you have these sorts of diseases, or if you have a different body composition than another woman who is pregnant, they may recommend that you supplement more of the folic acid, just because your body might need a higher percentage to combat those possible complications. And another thing to note is that non-pregnant women only consume nearly 207 micrograms daily of folic acid, and most of the time we get this percentage of folic acid from fortified foods or naturally occurring foods that have folate in them. So it's important to note that any average woman who's eating an average diet will not have the proper stores of folic acid if they do become pregnant. So it's important to, as soon as you know that you're pregnant, or if you're planning to become pregnant, to start supplementing the folic acid. So a menu, it was hard for me to come up with a dietary menu for this because folic acid is specifically a supplementation. So my recommended menu would be to consume 400 micrograms daily from supplementation. So there's a lot of different supplements. Some of them are on their own and some are in prenatal vitamins. So I would recommend finding a vitamin, something that is good for your body composition and something that you review with your healthcare provider. But I would recommend that it has at least 400 micrograms of folic acid in that vitamin. Also, along with this, I would suggest consuming products with fortified folic acid, such as breakfast cereals. So my example for a menu would be having 1 bowl of Kellogg's Corn Flakes per day. So there are a few side effects with taking folic acid. It is said to sometimes mask Persinius anemia, which is vitamin B12 deficiency. And vitamin B12 deficiency does cause some effects on your nervous system. And when it's masked by the folic acid supplementation, sometimes that can cause poor effects for your nervous system. It is also said that cancer can sometimes develop, specifically colorectal cancer, from taking folic acid, but this is very unlikely and very uncommon in women. And I would say that the benefits of taking folic acid in pregnancy definitely outweigh the side effects, which are very uncommon and I think need to be researched further. And then these are just my references that I used, and that is all. Thank you.